But if you want, Michael, you can go ahead and introduce Emily, and we can go from there.
Yeah, so we're excited to have Emily on to just kind of share about how she's been able to utilize personalized nutrients. It's been a joy and a pleasure, as a company, but as myself to serve her, and just like the care she puts into the work that she does, the research she does, and I think she really embodies what we hope to provide to practitioners of just personalized medicine, personalized nutrition. She's done such a good job of really implementing that within her practice and really just helping get better clinical outcomes with her patients in terms of just compliance and really helping them out and giving them personalized options. So we're excited to have Emily on. I know she's just going to kind of share a little bit about how it's helped her out in her practice and just kind of get into the formulator a little bit. And then, those of you that have questions, you could always pop it into the chat, or, you could, I'm not sure if you have the option to raise your hand on this, but I think there will be a time to answer some questions at the end. So Emily, yeah, we're excited to have you on, and just kind of turn it over to you.
Okay. Well, thanks for everyone for joining. I love seeing everyone's name and logo and picture. When you find a group of providers that do what we do, it's just so great. Our tribe to be with each other and understand each other and really glean knowledge from each other, from what works and what helps make our patients better. So when I was asked to do this, it was a no-brainer. It's a yes. I have done 800 personalized formulas. We just looked it up. I can't believe that. I don't know the specific year that I started, but the problem with my practice in the beginning of doing all this is, it's all the bottles, right? Well, you need an omega and you need a methylation support and you need your amino acid complex. And then if you're working on detox, and it just gets to be really overwhelming, and not to mention it gets to be really expensive. So if it's expensive, a lot of times your patients will just pop onto Amazon and buy, the most inexpensive thing to get the job done. And we all know that doing that is not really what we want our patients to do, because we really don't know what they're getting, right? And that was really driven home to me when I was working on my doctorate at Johns Hopkins. I actually went to the National Institute of Health for something called the Dietary Supplement Practicum. They have about 100 clinicians once a year that come, and it was all the big makers of industry talking about something called pharmacovigilance. And I had never even heard that term before. I didn't know it was a vocabulary word. And what that means is, there's a lot of differences in how products are made. And if we want to see outcomes, because we believe that a curcuminoid at 750 milligrams BID is going to work, well, if they go to Amazon and buy curcumin that's full of fillers and excipients and heavy metals and doesn't have the dose, and it was sourced from, something that's dirty, it's not going to work. And our patients are going to leave us because they're not getting better. So having something that's really quality has been a number one on my list. And I think, some of us prescribe only nutraceuticals. Others of us prescribe drugs as well. And I really look at the prescription for a nutraceutical like a drug. We have to have the right dose, the right patient, the right serving size, the right indication, and the right duration. And we need a good tool to do it. Just like I will not call in medications to most compounding pharmacies. I will to a very select few that I know that are going to make a good product for me, because I've even been burned by a compounding nutrient, not compounding nutrient, a compounding pharmacy. There's a lot of heterogeneity in them. So having quality partners, I cannot tell you, is so important, not only for our liability, but for the efficacy of our patient care. So when doctors data a long time ago sent out an email with their neurobiogenic amines test and say, hey, you can actually take this test and then formulate like their own kind of mental health support with it, I thought, okay, so Doctors Data is a big company and they do not, endorse anyone. I better go down this rabbit trail and see who these guys are. And I just really fell in love with using them because it's just been so helpful. And let me tell you how it's been helpful. So instead of prescribing a bunch of different things, I'm able to really say, we might do one or two things, but when I put together a personalized nutrient, I can ensure that I have everything in there that I want. Now, there's some things that you're going to find that you can't, like, you know, before we couldn't put omegas in there, and now we can put Avalum, which is an omega powder. So sometimes I use that, but you know, there's some things that they don't have. However, their formulary just gets more and more and more robust. They actually just source nattokinase, which I think is fantastic. If you guys have been using that for treatment of COVID and long COVID, that's been really important in some of our patients. So they're just always adding things. And not only if you can't find it, there have been times where, you know, like folinic acid to me is one of the most important forms of folate, especially for children that are growing and that might have folate antibody issues and need high doses of folates. And so, you know, I really asked for that and they sourced it and it ended up in the formulary. So, you know, they're willing to look at, if a lot of users really want this and it's not there, they're even willing to go out and look. And when they get an ingredient in, they test it then. And then after they make your personalized compound, they test it after that. So they don't do something called skip batch testing, which they just kind of spot check, which legally that's what they're supposed to do. They test every single thing coming in and going out. So we know there's a lot of quality and we're actually getting exactly what we think we are. So it really helps me to do N of 1 medicine. So say you're going to do a detox complex, but you know, you're really looking for sulforaphane and myrosinase, but you're not, you know, you don't want the extra alpha lipoic acid for whatever reason. You know, in the formulary, you can go in there and put exactly what you want in there, and you don't have the extra ingredients, and you really get to be mindful about your dosing as well. So, you know, like the example before with curcuminoids, we know 500 to 750 milligrams is an anti-inflammatory dose. So if you don't put at least that in, and you're sourcing another, you know, compound that is an anti-inflammatory compound, you might not be getting the efficacy that you want. So it really helps with formulating what you know, N of 1 for your patient to put in everything they need. And here's how it works. You know, they're not going to go to Amazon because they got to get it from you. And it is a higher price point to do a personalized compound. If you're just looking at one thing, like, oh, well, this one bottle is going to cost, you know, way more than this other one bottle. But the truth is, you know, say you manage your patients, and at the end of care, you say, well, that you need 7 different things. You add up those bottles, and then you add up the one bottle of the personalized nutrients, and it's a wash. If not, personalized nutrients is a cost savings for them. And so how I do that is I go in and I say, well, we could, you know, we could do a 3-month supply. And if we divide it by 3 months, you're usually looking at somewhere between $150 to $200 a month. And from the business side of things, and sometimes I give my patients it with no margin whatsoever. What's nice is you can make the compound and it'll say, you know, the provider pricing and then retail pricing. So you're still capturing that cost of selling a nutraceutical, because I understand that's an important revenue piece in our businesses. So you are, but then, you know, there's some families, I have some families that have very severely autistic children that, you know, can barely afford my care and barely afford a supplement. So, you know, I'll give it to them at my cost. And, you know, you always have the ability to do that. And sometimes that feels really good to do. So if you go in there and you say, well, we could do this. And sometimes I've even done that, you know, let's look at the cost of these 7 things and then the cost of this one nutrient, and your personalized nutrients almost always wins. There are some ingredients that cost a lot. So I really want to say that there's just some that are a little bit more expensive too. So like you can put ascorbic acid in your supplements all day long. But, you know, if you're going to put a ton of Avalum or the omega complex, it's going to be more costly. So sometimes I'll go in there and say, okay, well, gosh, this formula is going to be $1,200 for 3 months. I really need to try to take out some of the other ingredients that are more expensive to make it more affordable for the patient. So over the years, I've really learned, okay, this can be a little bit more expensive if I leave this out. Or, like they have lots of forms of folate, like I mentioned before. Now, folic acid, I hope not any of you are using. Folinic acid is very, very, very specific, but they have a couple of different forms of methylated folate. So one form's a little bit more expensive than the other. So there's ways to reduce your cost by really becoming familiar with the formulary too. So I look at that. And then we have two options. We can make it a powder or we can make it a capsule. Now the capsules are 00 size, and with Personalized Nutrient, they have a company called Compounded Nutrients where we started making formulations for our supplement company, NeuroNutrition. And I got real familiar with capsule size because most of my patients are, they're all pediatric or young adults. Some of them can swallow capsules and some of them can't. So you'll find that in your work along, if you have just people with problems with swallowing, the older you get, they feel like they're choking, etc. They are big capsules for Personalized Nutrients. They're 00. So you're looking at a big size capsule. I personally, I don't take supplements any other way now. I do a personalized compound for myself, and I have no problem swallowing them. You can always open and dump them out and mix them in food or drink if your patients don't want to swallow, or you can make them into a powdered compound. Here's the problem with the powdered compound, but here's how to solve it too. So,
hey, Emily, real quick.
Yes.
Would you mind, as you're kind of going through some of this, could you share your screen and kind of walk through the formulator as you're highlighting some of these?
Yeah, definitely.
Oh,
Okay,
awesome.
so how do I'm going to share
I think
screen.
we gave you the option to share screen. So
Can you see it now?
Yep, perfect.
Okay. I don't want to break HIPAA here, so I have it as a practice patient. Let's see. There we go. Yeah, so here we go. Here's our practice patient over here. And I always put first name, last name. So, Emily Gutierrez. And then what I do is the date, because often as you're renewing, revising, kind of making sure that you have the right formulation, you want to make sure that you have the right date. So I always just put the month, and it's not 28 yet, the year. So that would be our practice patient here. And then here's the here we go, powder, or we can do a capsule. Now, say when it does capsule, it defaults to 90 days, and there's always that compounding fee. So 90 days is great. It gives you 3 months, and honestly, it'll last for a couple of years. We want our patients to take them within 3 months because we want them to be treated, but they're not going to expire. Sometimes patients are like, oh, it's too many capsules. I did half of what you asked, and so they had it for 6 months rather than 3. But that's another great point, because if and that's part of it when I do this too, I'm like, now realistically, are you going to take supplements once or twice a day? And it's always better twice a day because it's like food. You want more of a steady state in your body, some in the morning, some in the evening, typically with food, so you don't feel nauseous, especially if you have a lot of minerals in your formulation. So you get the buy-in, you get the commitment from them. How many times are you going to take them? If they say, okay, Emily, I can do it twice a day, but I can only take 4 capsules, 2 in the morning, 2 at night, then I am going to prioritize my ingredients. And then you become really knowledgeable with, well, what ingredients take up a whole lot of space. So let's say we're going to do a 3-month formula. So I have 90 days, and then I'll search the ingredients. N-acetylcysteine is one of my favorite ingredients for managing OCD and anxiety, and glutamate. Great for lungs, great for lots of things. So I pushed, let me see if I can move this up here. So we have 1,200 milligrams. Now look what happened. My exact serving size. So here we go. Well, that's going to take up a lot of space, right? 1.44. So that's 2 capsules because I'm filling up 1.5. You see how that happens? And here's how much it's going to cost you. And here's how much it's going to cost the patient. So if we're like, all right, okay. So you notice that is it $100 compounding fee per formulation? There's a compounding fee per formulation, which means that if you do a whole lot more, if you do 180 days, each month is going to get cheaper. If you only do 30 days, it's going to be more expensive because you have that one-time compounding cost. So say we do this, and then I say, okay, so I'm going to make this. So I put in methylate. I shouldn't have done that. So I'm going to put in methyl. And look, here we go. We have quatrafolate, which is the branded form. And then we have L5-methylene tetrahydrofolate. These are both forms of methylated folate. So I know that this one's a little cheaper. So I don't really have a big difference between each form of methylated folate. So I'm going to go ahead and put it in. And look how small B vitamins are. They barely take up any space whatsoever. So we know with methylation, we got to have the cofactors. So I put in B12 that way. I should have put it in with an asterisk, and then it'll come up. And look at all these great options that we have. I'm really glad they don't have cyanocobalamin. So I'm going to put, not 100 micrograms. I'm going to put 1,000 micrograms. So 1 milligram in. And then I'm going to keep looking. I'm going to look for the cofactors. So B6, I'm going to put in. You see how it's going. I'm going to put in a little bit of riboflavin because riboflavin is a cofactor. So I'm going to say, okay, so what do I have in my formula? All right, so I have a good methylated B complex. I have some N-acetylcysteine. I want to go ahead and put some magnesium in this kiddo, and look at all these wonderful forms that we have. So I know that magnesium 3 crosses the blood-brain barrier better. So I prefer that for my patients because I'm dealing with a lot of neuro. And this is the elemental form of magnesium. I want you to notice that here, these guys have little PDFs. If you, oh gosh, it went somewhere on my computer. It didn't pop open, but you can pop these open and it can give you dosing for specific magnesiums. So I've just become very familiar with dosing of nutraceuticals over time, but this can always be a cue if your ingredient has one of these that can really help you with dosing. Say you're dosing it for a 10-year-old or, a 75-year-old. Dosing could be different and the form could be different. So say we're going to put 80 milligrams of elemental weight. Now look, magnesium is really heavy. So now I only have that much more space in this formula to get them to 2 twice a day. So let's see what else we would put in this. So for an anxious person, let's see, safranel. So this is their form of Crocus sativus, which is saffron. I wonder if your users I wonder if they're able to pull this up because they can't put in saffron, the common name of it. So that might be something to think about. But I'm going to put in a little saffron because it helps with serotonin production. I'm going to put in a little 5-hydroxytryptophan to support serotonin synthesis. And I've got a formulation that's nearing the 4-capsule mark. So I'm going to go back and say, okay, what else? Well, let's just say most people with mental health disorders have problems with zinc, or they need more. And then we're getting up there. I usually don't put in copper if I'm doing lower doses of zinc. I like zinc picolinate for the brain, but you might like bisglycinate or some other form. We just have so many choices, which is really nice. So when I do this is what I do as a provider now. So let's put a little inositol in here because let's fill it to the top as much as we can. So if I put 50 milligrams of inositol, and we can put grams and grams of inositol in it. So we're getting near the 4 capsules. So if you ride that line to 3.99, you can't guarantee that once they formulate it, it's not going to be 5 capsules. So then you're going to have your patient coming back and saying, hey, Emily, you said it was 2 twice a day, but I have 5 on the label. What should I do? I'm not sure what I'm going to do. Or if they're like, I'm only going to take 2 twice a day, like she told me, then they're going to get less methylfolate than I wanted them to have on a daily basis. So I try to ride the line probably around 3.75 or lower, just to get a little bit of room once they end up compounding it. Very rarely will it be less than what you think, but sometimes it can be more than what you think. So this patient, I would do well. And so how I do this in their chart is I'll go back here to the formula, and it's thinking on us. It's running a little slow. But I download it and I put a copy in their chart and I send it to them before they order it. And I have one of my assistants call them and say, okay, here's your formula. You should have gotten the formulation in the email. And basically, it's going to be $100 a month. And I always warn them it's going to be, and I'm going to put that, you see what I did there? I don't want to break HIPAA, so I went really quick. I did the eyeball. And it's looking at the formula here. So this is what, 3.67 for capsules. This is my practice patient. So I'm going to go up here and I'm going to print it on my end. And on my computer, it comes up save as PDF. So then I'll save it and I save it in my patient folder and I'll save it as their name. It comes up nicely here. So instead of view formula, and then I just put here, and then I save it. And so now they're going to see this and they're not going to see pricing on there, by the way. So if you are in there formulating with them, they will see the price unless you put it in provider view. And honestly, I've never done that. It's a new feature on the formulation to put it to where you can formulate and they can see it. I'm just so terrified they're going to see the price before I want them to see the final price. So I'm not quite comfortable with it yet, but I should get comfortable with it. And I think that just really helps your patients to understand, like, let's go back to the formula here. If you're doing this, see, and I think, let's go to patient view. They can only see the retail price. Did you see that? So now we're in practitioner view and you see the cost of the formula and the cost to the patient. But if you go into patient view, it's only the retail price. And I just really want to teach you guys about powders. And I know we're about to wrap up on time, so we keep it around 30 minutes. But out of this formula, I would say, look, okay, that's about almost 0.7 is not quite a teaspoon, right? If it was at 0.5, it would be half a teaspoon. So if I'm going to do a teaspoon of this formula, first of all, I've learned the hard way. There's some ingredients that are awful tasting. So think about your sulforaphanes, your broccoli seed extract, your N-acetylcysteine, your taurine. Sometimes those can taste terrible. And there's actually some forms of calcium that do not taste very well either. So, and I would imagine if you did a powder formulation with half of an omega, it's not going to smell or taste very, very good either. So on this patient, depending on if I really want them to have 1200 milligrams of N-acetylcysteine, this is going to make the formulation taste terrible. So I might go over here and say, okay, well, what are my options for flavoring? And let's see if I put a gram of coconut in there. Well, I'm almost at a teaspoon. But honestly, on this formulation, I'd probably go back and say, can we get away with 900 milligrams because it's going to taste bad? And then, can I put in 1.5 grams of coconut sugar? And I can actually probably put in a little bit more. And this isn't very much calories, by the way. I don't worry about getting this. So now they can take that. It's 1 teaspoon, dump it into whatever you want. Pomegranate juice, if you're going to use any juice, just because we know it has such amazing health benefits to it. But really, if you're dealing with a kid that's really picky, it's like whatever's going to get their vitamin in them. Hopefully it's not orange Fanta. Go ahead and dump it in there. So you can mix these in food. You can mix them in water. You can mix it in juice. You could even put it in a smoothie. Just the vulnerability is if you make them a big smoothie with their scoop of personalized nutrients in there and they drink half, well, then they got half of the formulation. So that's what I do. And since so look, it's also cheaper to do powders. So say I did a 30-day supply at this. Now the patient's looking at $180 to do a month trial plus your shipping. And right now they're running about 14 business days. I heard that we have a new facility and 15 new employees. So things are going to speed up a bit, but I would encourage you that it is really just, I mean, it's worth the wait. It's 100% worth the wait because you get a really, really quality product. So in the meantime, if there's something you want your patient to work on in the meantime, like, okay, so we're just going to give some Avmacol in the meantime and do, a bottle of Avmacol while we wait or something else. That could be an opportunistic time, or if you're, doing any kinds of medications or anything like that, as you wait for the personalized nutrient to come in. And you just tell them, it takes a little while to make a very custom supplement. And, with having space for that, when you want to renew, you got to give us a 3 weeks heads up. And sometimes, I'll go in there and I've put a bunch of iron and it's been 3 months and we got to take the iron out and I got to revise it. But it's super quick for me to go and revise it. And when I revise it, I always put the new date on there. So I know it's not 9/23, it's 12/23. So the iron's out. And then I upload that into their chart. So I have record of what personalized nutrient, when I gave it, and how we revised it. So I think I covered everything.
Yeah, you did a great job. I think we'll just open it up for questions really quick, but if you could just briefly touch on compliance and how that's been able to help just overall clinical outcomes, that would be great.
Well, it's very helpful for compliance too, especially when you have multiple family members. You guys know we're all health nuts on this call. I'm pretty sure we all take vitamins. It can be really daunting having, 4 or 5 things yourself. And then you've got 2 kids that have 4 or 5 things. And then your husband that's not as compliant as you are. It gets very, 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 very complicated. And then you run out of things. Like one bottle was 120 capsules and this one was 30 capsules and you're trying to order, and it's just, it's hard. So when we do a formulation, we know I want you to be on this at least 3 months. And I always tell patients, nutraceuticals don't often have the Advil effect, which is you take a nutraceutical and within 45 minutes, your headache's gone. It takes time to get in their system, and to see really long lasting change, someone that needs to be on a formulation at least 4 weeks, but really about halfway through the formulation, you should be seeing a lot of the things that you want to be seeing. And certainly by the end of that 3 months, that's a great time to revise. Like, well, my headaches, went from 4 a week to 1 a week, and you put 80 milligrams of magnesium. Maybe you increase it to 200 because they're doing really well tolerating it, and you're taking some other things out of the formulation. So compliance is good. You can label it. I didn't know this until like a couple of months ago, but you can put your own personal label on it, not personalized nutrients. You can put your own practice label on it, with Raphael and your practice and your logo. So, they have to come back to you to get a refill, which is great for business, but it's really great for knowing that your patient is doing what you're asking them to do. And it just really simplifies things. So compliance goes up a lot when you have a personalized nutrient, plus they've invested in it, right? So it's not like, oh, I bought this $20 bottle of vitamin C from Target. I'll take a couple of gummies every now and then. It's like, wow, I really invested in this. This is serious, clinical nutritional work, and I'm going to take it all because it was expensive and I invested in it. So compliance definitely goes up. You have to be careful with the powder formulations on taste, but I think if you do a month trial, to me, that's really how we've been able to make sure that someone's going to be able to tolerate the tasting of it.
That's awesome. Thanks, Emily. Yeah, I think just given we want to be mindful of the 30 minutes we allotted for this, just wanted to see if there's any questions anyone has. You can pop it into the chat or just come off mute and ask Emily. I'm sure she'd be happy to answer those.
I think there's 3 questions in the chat right now. Okay, that was Michael. And then Margaret, can you notify immediately when ingredients are out of stock?
Yeah,
okay.
I think we touched on that, which that is something we try to do as quickly as possible, but we apologize for if we're ever late on that.
Yeah, but from my understanding, when things are out of stock, it's because you can't source what you want, or you tested something and it wasn't up to par and it wasn't up to quality. So we have to jump and do something else. So you said doctor's data is the lab, products as well. No, so doctor's data is probably one of the biggest labs as far as the integrative and functional medicine space, them next to Genova Diagnostics. And then there's some other big ones, like used to be Great Plains and now they're Mosaic. But just doctor's data is where I even learned about personalized nutrients a long, long time ago. So they're one of my trusted lab partners for sure that I use. I think they have really ethical billing practices, and that's why I like to use them pretty much above other labs. That's all I'll say about that.
Selection of fillers.
Yeah. So so if we get a formulation to 3.75, what are you guys going to fill it with automatically to get it to 4?
Yeah, so that's something we take pretty seriously because there's a lot of chemical fillers that have some research showing there could be some negative health interactions. And so in powdered form, there's no additives at all. It's just the active ingredient selected at the selected dosage. And then in capsule form, if say it's 3.75, as Emily mentioned, of the 4 capsule dosing, we just use a microcrystalline cellulose powder to help fill that capsule. So no magnesium stearate or silicon dioxide, just a microcrystalline cellulose powder, which is what our vegetable capsule is made out of.
Mm-hmm. Awesome.
Yeah. So, yeah, I don't know if Justin, if you had anything you wanted to say as we kind of wrap up here.
Yeah, really wanted to thank Emily for being on this call. And one of the reasons why we started this practitioner webinar series, and we wanted to start off with a bang with Emily, is, as she started at the beginning of the call, she's done over 800 formulas. She's extremely experienced with not only the technology that we built to make this streamlined and easy, but she's also experienced with the clinical efficacy that you can experience with all of the manufacturing expertise that we've put in the last 12 years, pioneering personalized nutraceutical manufacturing. Is something that we're very passionate about. We really just love hearing feedback from all of our practitioners that are utilizing advanced diagnostic testing right alongside a personalized nutrients formula to actually illustrate a clinical outcome. And it's very powerful. We thank you all for being here today. And we'll continue to open it up for any questions that you might have, but ultimately you can feel free to reach out directly to us, and we can do these one-on-one consultations to walk you through the formulator. And as Emily can attest to, as soon as you understand how to formulate, you understand our formulary, the searchability of it, kind of the strategy behind, the dosing perspective. It's really a streamlined process, and you can truly service all of your patients without needing the burden of a heavy inventory of a mass-produced catalog physician line in your office, putting you in full control. So that would probably sum it up, unless you have anything else to add, Emily.
No, I mean, I would be happy to just, I don't work for Personalized Nutrients. I just really believe in them. And so it was easy for me to say yes to this. But I would, if other people have personal questions about, things that they're doing in their practice as far as using your services, I'd be happy to be connected with them too. So it's a great tool.
And Donna asked is the chemical binder. So in the capsules, if we say it's 3.75 is the tap density of the 4 capsules, meaning there's 0.25 left that we need to fill the volume of, we use a microcrystalline cellulose, which is a powderized vegetable capsules. It's close to nothing as you can get. So we're not using silicone dioxide or titanium dioxide or these chemical excipient lubricants. We're using all active ingredient and MCC. If you have an issue with MCC, you can request to use another ingredient. Now, say you wanted to use, an extra magnesium glycinate, you can do that. We have a lot of practitioners that use arabinogalactin as a filler. You can do that as well. Just really, it's truly personalized. It's up to you. You can even do a personalized filler, but if you don't by default, it will be MCC to just fill that up because it's the most benign material that we do need to hit the fill weight of each capsule at that point with that.
I think inositol is another one that's real good to use as a filler too, if you've never considered that as well. Therapeutic dosing of inositol can be something like 10 to 16 grams a day. So adding 20 milligrams is not gonna, it's gonna be just a nice little addition and filler.
Absolutely. All right. Anything else while we're all here? Well, we thank you from the bottom of our hearts, Emily. We appreciate you.
Thank you, Emily.
Yay. Nice to see all of you.
Thank you all. Have a great day.
All right. Bye, everyone.
Bye, guys.